opinions about the cost of care and how Dr. Butler was saying, we've been educating people and we've been educated ourselves, but how do we actually go forth with decreasing unnecessary procedures or, MRIs versus x-rays, at least in primary care. That's what I find a lot when a lot of kids come in with a hurt ankle, they automatically want us to order an x-ray. And so I find a lot of times, especially with pediatrics, it's kind of battling the parents almost because they want us to do something. They want us to see the x-ray to make sure that it's not broken. Whereas, when we're following the different criteria for how to order an x-ray, I kind of find that that's a barrier for me to, try and educate them and explain to them why every kid that comes in with a sore ankle doesn't need an x-ray.
I see that a lot in my practice as well as with ultrasounds. People and, ultrasounds really nowadays have come to the point where people are doing ultrasounds for fun and for, these, great pictures and things like that. And I really have to kind of counsel and educate my patient population about the overuse of ultrasounds and the fact that, we got a 20-week ultrasound that was great. Unless something shows different on your exam, we really don't need to do any more ultrasounds in your pregnancy. And that's really hard for some people, especially around this area, to grasp. So I can relate to the x-ray for every kid. I can totally relate to that.
As far as healthcare costs, just from a personal standpoint, I feel like the care is being diminished, or what's covered is being diminished, and my healthcare costs keep rising.
It's just so frustrating because if it was just kind of one payer, like Kitty was talking about, if there was just one payer, we could have this kind of figured out by now. But as soon as you learn it, then somebody has a variation of that kind of insurance, and it's like, oh my goodness. So yeah.
Yeah, it gets to be a big mess trying to figure out everybody's specific plan, and they want to know, does my insurance cover it? I have no idea.
I have no idea.
It's kind of ridiculous how expensive it is, and again, trying to find the right medications for your patients, ones that are going to be cost effective, but also they're going to be effective in treating the disease that you're trying to treat.
Society focused more on taking care of patients instead of making more income, we would be in a better place, period.
And I feel like we as MPs and CNMs and, PAs, we are part of that, high value because we are expanding to rural areas and just filling a need. So I think that in essence, our role helps maintain that. But I agree that definitely as a DNP leader, you can go a step above that in policy and just lobbying for different and, more expanded rights in a lot of states so that we can meet those needs further.
I think that policy, I can't remember if it was Kitty or somebody else was saying, it's kind of intimidating, going on DC and stopping and advocating for policy. But I think that's where the DNP role really kind of come to play as far as education.
Yes, we do want more time. We may see fewer patients in a day, but if you allow us to move forward like this, we will have fewer comorbidities and fewer sick visits because of things that we were able to prevent in the start. So challenging that.
It's like, okay, so at what point don't we start giving back so that the whole system can be better? This project and I working through this DNP showed me, us translating evidence into practice. That may be how we contribute.